You've consulted with your physician and your family, and together, you have decided that having this surgical procedure is the right thing for you. You've chosen to have your procedure at Southeast Hospital, where you can rest assured that your care will be top-notch. You have already had some pre-surgery tests, but additional testing may be necessary before your procedure. It's important to you and to us that you and your family know what to expect from pre-op to post-op to your journey home and beyond. Let's take a look. You have most likely started the preoperative process before you arrived at the hospital. You received instructions to fast for a specific period of time before surgery so that your stomach is empty. This is important for your safety and must be followed in order for your surgery to take place when scheduled. We'll make sure you understand these instructions during your pre-admission testing, and we also will confirm this on the day of your procedure. When you arrive at the hospital for your surgery, you will be greeted by our friendly staff at the front desk, and you will register there. After registering, you will be escorted to the pre-op extended stay waiting room. You and your family can wait comfortably here until a member of our pre-op team comes to take you to the pre-op room. We will ask you your name and birth date to make sure we have identified you correctly. Because patient safety is at the heart of all we do, you may be asked to share your name and birth date many times. That's not because we don't know who you are. This is to ensure that you are having the correct surgical procedure, correct medication, or correct lab test. We care about your well-being every step of the way. At the pre-op room, you'll change into your hospital gown. We ask that you leave all your jewelry and other valuables at home. If you forget, these will be removed and given to your family. It may be a bit cool in the pre-op room, so we will provide you with a warming blanket to keep you comfortable. There's a very special reason for this. The temperature in the operating room is colder because surgeons wear large, heavy gowns. We pre-warm you before going into the operating room to make sure that you have the best outcome during your procedure. We will confirm your pre-surgery fasting status again to make sure you have followed these important instructions about when you stopped eating and drinking. In addition to the warming blanket, your legs will be fitted with a compression device that reduces your risk of a blood clot forming in your legs while you're asleep. We will check your vital signs to make sure your temperature and blood pressure are okay. We will also review if you have any allergies to food, drugs, or latex. Then we will do a final check to make sure we have a correct medication list and that the medications you were told to stop were stopped accordingly, such as blood thinners. After safety checks are complete, a nurse will start your IV. It's a little needle and a very small tube that is placed in the vein to keep it open so that we can give you fluids. All the medications we give you are delivered through the IV, so no more needle sticks after that. Once your IV is started, your anesthesiologist will come speak with you. He or she will go over your anesthesia plan for the day and will explain the possible risks of anesthesia, as well as anything in your lab work or x-rays that might be cause for concern. At this time, if you're anxious, we can give you a little bit of medication to ease your anxiety. If you are having pain, we can also give you medication for pain control. Our goal is to keep you as comfortable as we can. Please let your nurse know what pain level is an acceptable pain level for you. We use the term on a scale of 0 to 10, with 0 being no pain and 10 being the worst. Please also know that we will try different types of pain medication to help relieve your pain. Once that's done, your family members can come back to be with you. We allow 2 family members to be with you as much as possible during your surgical experience to help reduce your stress and make you feel more at ease. The anesthesia provider will then come in to review everything with you one more time. This may sound repetitive, but it's to keep you safe. We want to make sure that all through the system, everybody knows who you are, what procedure you're having done, and who your surgeon is. You will then be escorted by your operating room nurse to surgery. We have a very special tracking system at the hospital that lets your family stay updated throughout your procedure. Once you leave the pre-op room, your family will be given a yellow card with your case confirmation number on it. In the surgery waiting room, there is a large monitor which displays your confirmation number and the current stage of your procedure in real time. Taking care of your family is just as important to us as taking care of you. We will call the surgery waiting room to let your family members know when your surgical procedure started. We will keep your family informed every hour. Please remember that it may not be right on the hour. because our first priority is to care for you. But we will try to keep it as close to the hour as possible. And if at any time a family member feels they need to know how things are going, just ask one of our friendly, knowledgeable volunteers at the surgery waiting area desk. They can make a call and provide you with an update. Once you come out of our operating room and are brought back to our post-anesthesia care unit, you'll be connected to monitors to allow nurses to have a constant eye on your vitals. According to your pain level, they'll also give you pain medications at this time. Waking up from anesthesia can be different for everybody. Some patients wake up quickly, while other people take a while to wake up, which is not uncommon. The best thing is just to allow yourself to wake up. Don't think that you have to fight it or immediately be awake. Just relax and wake yourself up slowly. The nurses will have a constant eye on you to make sure you're doing okay. If you're spending the night with us, this is when we'll make arrangements for your room. If you're an outpatient, you'll be taken to outpatient recovery where your family members can once again be with you. This is the last step before discharging you. We'll do several things for you here. We'll make sure you're able to drink something. We'll walk you to the bathroom to see how well you do. We'll give you medications for nausea if you need them, because nausea is an occasional but temporary condition after anesthesia. And finally, the anesthesiologist will come check on you and sign your discharge papers. Then you're ready to go home. Before you leave the hospital, you'll receive a set of discharge instructions from your surgeon, letting you know what kinds of activities you can do once you're home, such as showering the next day, what kinds of foods you can eat, and when you'll go back to see your surgeon. All of these things will be carefully and thoroughly explained to you and your family before you leave. Even after you're home, our care for you doesn't stop. We'll call to check on you the next day to make sure you're doing well. The first 24 hours after surgery are the most important. Although it's extremely rare, if you're having any problems, we would advise you to call your surgeon or go to the nearest emergency room. If you're still experiencing nausea, don't worry, it will pass. You can have nausea for up to 24 hours after surgery. So now you know what to expect when you're expecting surgery. Just remember these key points. 1. Our care for you starts well before and ends well after your procedure. 2. Your identification is constantly verified and re-verified through every point in the process to keep you safe. And 3. Your family is an important part of your successful outcome. That's why we keep them informed of your progress every step of the way. Here at Southeast Health, from the time you enter our doors until you leave and even after that, our focus is on you and your family. We treat you and your family the way we would like our own families to be treated, with kindness, with care, and with respect. It's our promise to you.